If you're making your health decisions based on headlines, you might be putting your health in a precarious situation. I'm Dr. Jeff Cumro, and over the past 15 years, I've been blessed to help thousands of people optimize their brain function, their body function, and then supply the energy to those areas so that no matter what environment they're in, they can pull the response that they need to get the outcome that they want. So I saw an interesting headline. I'll put it up here so y'all can look at it. But ultimately, what this headline was saying is that high-fat diet leads to memory issues in older individuals within 3 days. And on the surface, that's very interesting, right? But let's dive into a couple of things that can really throw this off. And this is the type of thinking that you need to use on any of these headlines, because there are so many of these. Every week I see them. They're headlines that don't give you a full truth, or are, they're making broad-based statements off of one quick research study, and it doesn't take the whole compilation of research into consideration. So in many cases, it's not fully true, and it may be dangerous to follow that recommendation. So the first thing we have to ask ourselves on this is, what type of fat were these people eating? Were they eating trans fats, which we know are terrible for us, right? Those are the ones that are basically partially hydrogenated or hydrogenated fats, the Criscos and things like that. We know that those are bad for us. We know that they have a negative health impact. If we're feeding people that, there's going to be problems. It causes problems in blood flow and different things like that. Those are very, very bad for our arterial circulation. It's very, very bad for our inflammatory levels and all sorts of different things there. So all of that obviously plays a role in our memory. So if we're feeding them those types of fats, that's probably going to be a negative for them. If we're feeding them those omega-3 fatty acids or omega-9 fatty acids, omega-6 fatty acids, if we have those in the proper ratio and we see this research, that may be a different thing. So, that's something that we have to look at, is what exactly were they feeding them? And I haven't looked at the actual study yet. I just wanted to cover this headline because this is the type of thinking that we need to use. So I don't know what kind of fats they gave them. It's just questions that need to be asked. Next question we need to ask is, were these people that they were feeding these healthy to start with? Because if they're not healthy to start with, in a lot of cases, they're going to have some sort of blood flow issue. They're going to have some sort of memory impairment. And the big thing is they're going to have some sort of digestive impairment. So as we age, as we get stressed, we start to turn down our stomach function. And that goes with stress in all ages, not just in old age, but in all ages. As we get stressed, we start to turn down our gut function. Said another way, aging is stress. The more stress takes over, the faster we age. So as we get older, we have a higher stress state than when we were younger. We are less resilient. It makes sense, right? So we start to see more of that gut dysfunction. Now, why is this important? If we don't have enough stomach acid, particularly lipase, we don't break down fats the way that we should. So are they getting the energy that they really should out of the food that they're eating? Perhaps they're pushing more blood sugar. Blood sugar can be a good thing. The brain actually, burns blood sugar for its energy. That's what gives it its metabolic supply. But if we have too much blood sugar, then it damages the nerves, right? And we see this in diabetics who have foot neuropathy or hand neuropathy or memory issues or different things like that. As we get too much of that blood sugar, then it causes problems, and that can be caused by digestion not breaking down fats the way that it's supposed to. If we're not getting enough of the healthy fats, if we're not breaking them down the way that we're supposed to, then we kind of push our energy into that glycemic state where we burn blood sugar, and that's a problem. So that's another question we need to ask. And the third question we really need to ask is, as the brain burns that blood sugar, how much did we increase the fats? It was a 60% fat diet. I know that from reading this article. I didn't have to read the research article to figure that out. But I don't know what the rest was composed of. So was the rest composed of protein? If that's the case, we have a ketogenic diet. How many people have done a ketogenic diet here? One of the biggest things we hear about is the keto flu. What is the keto flu? It's where you feel absolutely miserable for the first couple days after you take out carbohydrates from your diet. If you take out those carbohydrates and your brain burns that blood glucose, it takes you a couple of days to get that ketone supply, which is what it switches its metabolic function to if you don't have glucose. But it takes a couple of days for that to really happen and catch up. and those people can be absolutely miserable in that time frame. So the study was done for 3 days. Now, if you have somebody who has the keto flu and you switch them over to that, is that still going to be an effect? Stereotypically, you're going to see that disappear around 2 days. But in older people, in higher stress states that are more reliant on blood sugar, very, very possible you're going to see a little bit of extension into that. They may feel it for 3, 4, maybe even 5 or 6 days, just depending on the state or their current condition, depending on how much you change their diet. So there's more questions that we need to ask from this. But I see all the time the news like bombarding us with ultimately propaganda is what it is. It's pushing you in a certain way, but this is telling you that a high-fat diet is terrible for you. There's not really research behind the saturated fat causes heart disease. You know, ultimately, that was somebody's guess back in the 1960s, I believe, and look at what it led to. Have we had a decrease in heart disease? No. We've had a massive increase in heart disease. Why? Because when they said a high-fat diet was terrible for you, eat more carbohydrates, what did everybody push to? Simple carbohydrates. The simple carbs, the sugars, all of this extra stuff that drive heart disease. So we really have to take a little bit deeper look at any of the health information that we see blasted out on the news media and all of this stuff, because it can be detrimental to your health. And that's the thing we have to look at. We can't just take one study and say, this is science, because that's not science. That study has to be repeatable. Other people have to be able to take the information that was provided by the authors and repeat it. And a lot of science, A, isn't. B, the other thing about that is one study doesn't mean anything necessarily. We need multiple studies that are going to say the same thing. We need different ways of looking at the same information to actually corroborate what we're actually looking at, to understand what we're actually looking at. Because with just one piece, it's like trying to make a decision about your future. So say you're a high school kid and you're trying to pick a college and you want to go to a big college, but you go and visit one college. Does that really give you a good idea of which college in the nation is the best fit for you? You're making decisions off a limited basis, right? There might be hundreds of other colleges that would be better, but if you only look at one, you're going to have limited information, and that's what you're going to go with, even though it may be detrimental to your future. And that's the big thing we have to watch with this. So I hope that you find this helpful. If you have questions, obviously you could drop them in the comments. I would appreciate a like or subscribe if this is something that helps you. It gives me good information as far as what I can share to help you get the results and get the health that you want to get. So as always, I appreciate your time and attention. I know that's your most valuable resource, and I appreciate you spending some of that with me. And I will catch you on next week's video.